Hello, everyone. My name is Dr. Helen Wynn, and I'm a dentist at Forsyth Kids, the Forsyth Institute school-based dental program. Today, I will be talking to you about silver diamine fluoride, or for short, SDF. For a lot of you, this could be the first time you're hearing about SDF. SDF is a liquid like you see in the bottle on the bottom left of this screen. It can be used to make teeth less sensitive, but it can also be used to stop cavities from growing. If SDF can stop cavities from growing, SDF can change the way we treat cavities. Using SDF can stop teeth from becoming painful or hurting later on and can keep you from losing the tooth earlier than you should. For our talk today, I want to tell you more about how cavities form, how SDF can stop cavities, and how we can prevent tooth pain and tooth infections with SDF. As you can see here, this is a picture of a child's mouth and some of their teeth. Right here, you can see a white film or buildup. It might be a little hard to see on a picture, but you might notice this film in your own mouth when you wake up and have a fuzzy feeling on your teeth and tongue. This film is called plaque. It builds up every day and gets removed when you brush and floss your teeth. This plaque has bacteria in it. Sometimes dentists call these bacteria sugar bugs. When we brush and floss our teeth, we get rid of the sugar bugs so they can't make cavities in our teeth. Let's see what happens if the plaque doesn't get brushed away. If you don't brush and floss your teeth, the bacteria or sugar bugs stay in your mouth. When you eat foods, the sugar bugs eat the sugars in your food too. When this happens, the bacteria make something called acid. Acid is a chemical that can break down your teeth and start cavities. When the bacteria eat the sugar and make acid, the acid breaks down part of the tooth and makes that part soft. The soft part becomes the cavity. And if more bacteria eat more sugar and make more acid, more of the tooth gets soft and the cavity gets bigger. The cavity does not usually hurt when it is small and just starting, but as it grows bigger and bigger, the cavity can start to hurt. Let's see why that is. As you can see here, the tooth has different layers. These layers help the tooth protect itself. The outside layer of white you see is called enamel. It is the hardest part of the tooth and helps protect the inside of the tooth. The orange layer you see is called dentin, and this part is less strong than the enamel layer. The red on the inside is called the pulp. This is where the nerves and blood supply for your tooth are. The yellow spots you see on the first tooth are called plaque, and that's what we just learned about. Remember, the bacteria or sugar bugs live in this plaque. On the second tooth, you see brown spots in the white enamel layer. These brown spots are cavities that are just starting to grow. Cavities like these don't usually hurt. The next tooth has cavities that are in the dentin layer, or the second layer of the tooth. Sometimes these cavities won't feel anything, sometimes they're sensitive, and sometimes if they're big cavities, they can start to hurt. And on the last tooth, you see a cavity that has gone through all the layers of the tooth to the pulp. This is a cavity that would most likely hurt or cause an infection. If we stop cavities before they grow big and into the pulp, we can stop them from hurting and causing infections. The other thing is that as a cavity grows through the layers, it can start growing faster and faster. Remember, I said the enamel is very hard. The cavity would grow more slowly here than in the soft dentin layer. This means it is important for us to stop the cavity as soon as possible. SDF can be used by dentists to help stop cavities from growing. If we put SDF on these cavities, we can stop the cavity from growing before the tooth starts hurting or before it has an infection. If we can stop teeth from hurting or having infections, this also means we can keep the teeth longer. And the sooner we put the SDF on the cavity, the better. Now that we know more about the tooth and cavities, we can learn about how SDF can help us with cavities. Remember that SDF is short for silver diamine fluoride. There is silver and fluoride in the SDF solution, and these both play big parts in stopping the cavity from growing. The silver part acts like an antibacterial and helps kill the bacteria that cause cavities. It's kind of like how you use antibacterial soap to kill germs on your hands so you don't get sick. The SDF kills the sugar bugs on your tooth so your tooth doesn't get sick. Fluoride is like a vitamin that helps make the tooth strong, which also helps protect the tooth from cavities. When the tooth gets fluoride from SDF, the acid has a harder time making the tooth soft. That means it will be harder for a cavity to grow in a tooth that has fluoride in it. Both the silver and the fluoride in SDF work together to stop the cavity, and this prevents the tooth from hurting or having an infection. The best part about SDF is that it does not hurt at all. When the dentist puts SDF on your tooth, there is no need for any numbing medicine, which means there's no needles, and there's no need for a drill. Also, the procedure can be made aerosol-free, which means it's safer for you and your dentist in times of infectious diseases, such as now during the COVID-19 pandemic. Putting SDF on your teeth is also very fast. It only takes a couple of minutes from start to finish. Once everything is ready and prepared, the tooth is dried and the SDF is painted on with a little brush, like you see in this picture. We want about 1 minute of painting the SDF on the cavity so the SDF can soak in and reach all the parts of the cavity. With SDF, there is some staining that will happen. There can be some staining on the skin, lips, or gums, but that will fade and go away in about 1 to 2 weeks. The staining on the tooth will last, but this tells us that the SDF is working on the cavity. The SDF only stains the cavity or the unhealthy parts of the tooth. Here you can see the cavities. This area looks kind of orange and soft. In this next picture, the SDF was applied to the cavity. It looks a little brown now. In this last picture, it's 1 week after the SDF was applied. We can see that the cavity is stopped from the dark stained part of the tooth. You can also see that the healthy part of the tooth is not stained at all. Again, SDF only stains the cavity part of the tooth. And if you have SDF placed and decide later the stain bothers you, most of the time fillings or other treatments can be used to remove or cover the stained parts. Cavities can grow quickly, especially in children. When cavities hurt, they can stop your child from eating or speaking properly, and it can be hard for your child to concentrate on learning. It can also be hard to get to the dentist quickly if your child's tooth starts hurting. We understand that some dental offices have long waits for appointments. It might be hard to get the time off work to take your child, or in times of a pandemic, the offices might be closed altogether. Also, some children can't have treatment at the dentist's office because they are too scared, can't sit still long enough for the dentist to work safely on them, or have too many cavities that need to be treated. If we can stop cavities from growing now with SDF, we can stop our children from having tooth pain or tooth infection caused by a cavity. We know that countries like Japan, Australia, and China are already using SDF to treat cavities safely and effectively for over 80 years. In the US, SDF is used to treat sensitive teeth, but we know it can also be used to treat cavities like we've seen all over the world. Children with cavities can really benefit from SDF now so we can prevent tooth pain, infections from cavities, and prevent premature tooth loss or losing the tooth before the child is meant to. For most teeth, the cavity will stop growing and just require more SDF placed at your child's regular checkups. For some teeth, the cavity may require other treatments. Just as always, regular checkups are still very important and necessary when your child has SDF placed on their cavities. We need to check that the cavity has stopped growing and see if there are any new cavities or other problems in the mouth. We also need to put more SDF on the cavities to keep fighting the sugar bugs and give the healthy parts of the teeth more fluoride vitamins. The Forsyth Kids team checks on the cavities every time they are at your child's school and will apply more SDF when needed. We hope you enjoyed learning more about SDF with us, and if you have any questions about it, please feel free to reach us by phone or email. Thank you very much.